All right, welcome back to ABA exam review in the continuation of our BCBA practice questions series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyst.study.com for all of our study materials. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst established a prompting procedure where their client would throw trash away in the trash can if prompted by a finger point at the desired location. If the behavior analyst wanted to transfer stimulus control to the trash can, what should the analyst do? So we have a stimulus transfer control question. And when we think about stimulus transfer control, we're often thinking about prompting because when we use prompts, those prompts act as temporary SDs for the response we want to see. Now, when we're teaching responses and target behaviors and those sort of things, we obviously want our real discriminative stimuli to evoke the behavior. In this case, the analyst is prompting with a finger point. Now, you don't want the finger point to be the SD for throwing trash away. Eventually, you just want the client to throw trash away on their own. And the way we need to get there is by fading or transferring control from the prompt to the trash can itself. So how do we go about doing that? How do we transfer control from the prompt to the trash can? A, begin using physical prompts to prevent errors when the client attempts to throw items away. The last thing you want to do is use a more intrusive prompt because now you're going to work even harder to have to fade that prompt out. We're already at a pretty unintrusive prompt with the finger point, so you don't want to go deeper into the prompt hierarchy by using physical prompts. B, start reinforcing the client for throwing items away in the absence of the prompt. Perfect. What we want to do is try to start removing that prompt altogether. Right now, the client is reinforced in the presence of the finger point, which is making it the SD. We have to remove the finger point and have them be reinforced just in the presence of the trash can and throwing away the trash without the prompt. That's how we're going to transfer control. C, thin the reinforcement schedule when using the prompt. We can thin schedules, we can thicken schedules, but as long as we're using the prompt, we're never going to transfer control fully to the trash can. And then D, use a verbal prompt instead of a gestural prompt. Again, even though the verbal prompt isn't as intrusive as the physical prompt, it is still a prompt. We want our SD to be that trash can in this case, or you might teach the client when they're done with their food, that'll be the SD for throwing it away. Whatever it might be, we want to fade control from the prompt to a more naturalistic SD. And in order to do that, we have to start reinforcing in the absence of that prompt. If we continue to reinforce when the prompt is present, that prompt is going to continue to maintain control over the behavior. Tina changes her client's reinforcement schedule in the clinic from an FR3 to a VR4. This client also receives services at home and at school. Tina wants to reduce behavior contrast as much as possible since the client has a history of behavior contrast. What should Tina be sure to do in order to reduce behavior contrast? Behavior contrast that occurs when there is a change in behavior in one setting and the opposite change in a different setting. And this often happens when reinforcement schedules are changed. Specifically, when a schedule is changed in, let's say, the clinic setting, but not the school setting. Now, the two schedules are different. Behavior is going to start to respond differently. In this case, Tina has changed the schedule or thinned the schedule in the clinic from an FR3 to a VR4. So she thinned it pretty strongly, meaning the client's going to work a lot harder for reinforcement in the clinic. Now, the thing is, the client also gets services at home and school. Since Tina already knows behavior contrast is an issue with the client, what does Tina need to do to try to reduce that contrast as much as possible? A, make sure that the reinforcement schedule changes are happening in the home and school as well, and that the changes match. Yes, what you want to try and ensure is that wherever services are being delivered, you want consistency. If you have a whole bunch of different schedules operating on the same behavior, that is going to confuse the behavior. The behavior is going to start acting or occurring in different settings according to that reinforcement schedule. So if you don't want behavior contrast, those schedules need to match as closely as possible. A looks good. We always read all of our answer choices. B, offer more reinforcement in the home and school on a thicker schedule. Well, if she thinned the schedule in the clinic, she isn't going to want to thicken the schedule at home and school. That might actually encourage behavior contrast. C, start implementing punishment procedures in both the home and school setting. There's really no need to implement punishment. We're still working on a reinforcement schedule. We're just looking at the behavior contrast relative to that reinforcement schedule. Introducing punishment in home and school can introduce a whole slew of new or different behaviors that have nothing to do with the change in the clinic. So implementing a whole new procedure isn't going to be what Tina wants to do. And then D, switch to an interval schedule in the home and school setting. Now, in theory, the interval schedule could be thinner, but we don't know for sure. So we don't have really enough information for D, where D is going to be better than A. With A, we know we're changing the schedule, and we know it's happening in the home and school, and we know it's going to match the clinic. Therefore, A is going to be our best answer in order to reduce behavior contrast. A behavior analyst uses a multiple probe design to assess the effectiveness of a new reading intervention across 3 students. Baseline data are collected intermittently rather than continuously to avoid unnecessary exposure to intervention conditions. What is the advantage of using this type of design? Pretty straightforward advantage question. We know we're using a multiple probe design, and it's exactly what's described here. In baseline, we're not collecting data every session. Rather, it's going to be intermittent. Now, why would we want to do that? And so off the bat, the question says they want to avoid unnecessary exposure to intervention conditions. So that's already one answer they've given us. What are some other advantages of using a multiple probe design if we're trying to teach this intervention to 3 students? A, the analyst is able to gather more data more quickly than using a regular baseline design. With a probe design, you're going to have less data because you're not continuously measuring. You're just probing. You're going to have much less data using a probe design. So A is out. B, the analyst can minimize practice effects and reduce reactivity. Sure, with the probe design, there's less opportunity in baseline for the intervention or the client to learn, I should say, less opportunity for the client to engage in any behavior in baseline, which could reduce practice effects. And it's going to be less contact with the researcher and whoever else is helping with the design. So we can reduce reactivity at the same time. B looks pretty good. C, the analyst can collect more accurate inter-observer agreement data. Well, C suffers from the same problem as A, where you're not going to have more data with the multiple probe. You're going to be taking less data. Therefore, the inter-observer agreement could still be accurate, but there's no indication that it's going to be more or less accurate. And then D, the analyst can start intervention sooner for participant 2 and 3. It's also not necessarily true. Even with the probe design, you still need to let that intervention play out to an adequate amount of time for your participants. So just because you're probing in baseline, that doesn't really change your time frame for intervention. So really the only advantages listed here are going to be B. You can minimize practice effects and you can reduce reactivity. A behavior analyst is using a fixed interval 8 schedule to reinforce a client's task completion. After completing 8 tasks, the client receives a token for their token board. The analyst observes that the client tends to become unresponsive after receiving each token before beginning the next set of tasks, no matter what the task is or how it is presented. What would we call this unresponsiveness? So we're focused on the unresponsive behavior. So let's map this out, right? The client completes 8 tasks and they get reinforcement. Then we have a pause, 8 task, reinforcement, another pause. What do we call that pause and why does it occur? Well, it occurs because the client knows the schedule is fixed. And so, especially on a fixed interval 8, right, whether it's 8 seconds or 8 minutes or whatever it might be, they still are going to have to wait till that schedule is complete to receive reinforcement. Now, the question doesn't really make a ton of sense. We're on a fixed interval 8 schedule and they complete 8 tasks and they get a token board, but that's irrelevant, right? Because we're just asking about the unresponsiveness of the client after getting the reinforcement. So focus on what's important here. What do we call that unresponsiveness once a client receives a token? Do we call it scalloping? Well, scalloping is when a client engages in rapid amounts of responses once that reinforcement schedule is almost finished. And we're not doing that here. What's happening is reinforcement is being delivered, and then there's a pause. So we call it ratio strain. Well, ratio strain occurs when we thin a schedule too quickly and reinforcement stops altogether. It's not ratio strain because nothing was thinned. It's not a response burst either. We don't have any responses, right? It's unresponsiveness. So what it's going to be is D, a post-reinforcement pause. The client receives the reinforcement. The client then pauses before engaging again to receive more reinforcement. So if there's unresponsiveness following reinforcement, we consider it a post-reinforcement pause. Richard is teaching a client with autism to greet peers appropriately. Initially, the client learns to say hello during one-on-one therapy sessions. Richard then arranges for the client to practice greetings in different settings, such as during recess, at home, and in community settings with various peers. What strategy is being used? All right, strategy question. What do we know so far? We know Richard is teaching a client to greet peers. We know the client learns to say hello in one-on-one. And now Richard is going to teach in natural environments, different settings with other peers. So Richard is working on generalization. And what kind of strategy is he using to promote that generalization? A, stimulus fading. Is Richard fading anything out here? No, we don't really discuss fading of stimuli in this particular question. What about B, programming common stimuli? When we program common stimuli, we take stimuli that might appear in our environment and we program it into the teaching session. Richard isn't doing that in his one-on-one sessions. He's taking out the client and he's actually training on the exemplars. When we talk about C, training loosely, that's when we vary aspects of the training environment. Again, Richard's not doing that. He's taking his client out and actively training them in natural environments with different people. He's training multiple exemplars. So the strategy he's using is D, multiple exemplar training. Thank you so much for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. We'll see you soon.